Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
Hello and glorious day, everyone. My name is Dr. Lara Varden. I'm a licensed clinical practitioner with the DNA Company, Dean of the DNA University, and Managing Editor for the DNA Talks Digest. As a PhD, I have expertise in cellular biology, molecular genetics, biochemistry, neuroscience, and functional nutrition. It is my honor and pleasure today to welcome and interview a friend of mine, Dr. Jenn Simmons. She's a trailblazer in the world of breast cancer. After years as a top breast cancer surgeon, her own experience as a patient led her to redefine how we diagnose, treat, and screen for breast cancer. Now, an integrative oncologist and functional medicine physician, through her medical practice, Real Health MD, she is on a mission to help women reclaim their health and vitality after breast cancer beyond just survival. She is the best-selling author of The Smart Woman's Guide to Breast Cancer, host of the podcast Keeping Abreast with Dr. Jenn, an international keynote speaker, and is reinventing how we screen for breast cancer at PerfeQTion Imaging. Jenn, thank you for being here. I was so delighted to get to meet you in person at A4M this past December, and it's just been a dream of having you here and just getting your brilliance and energy out to the world. So thank you for being here.
That's very kind. And I'm delighted to be here. It's always so nice to be able to connect with people in person. You know, we do so much over Zoom these days and all of this, video screen time. And we think that we know everyone so well, but we actually never got to meet them or hug or anything like that. So it's always so nice to meet people in person.
Absolutely.
And as the kids would say, IRL.
Yes. And I even got to meet your pup.
I know. And I hope my pup behaves. Let's hope. Let's hope my pup and his 3 siblings behave while we do this today. It's anyone's guess.
Well, I'll tell you, so many people know you and have heard of you, but for those who may not know, your story, or for those who may be learning about you for the first time, I would love to have you share with us what your background, as far as what was the pivotal moment, the experience that drew you into this world, into this medical innovation, into doing what you're doing?
You mean there are people that don't know who I am?
8 billion people on the planet.
So, I come by the world of breast cancer very organically. I didn't find breast cancer. Breast cancer found me. I come from a breast cancer family. Literally, I come from a very big family, and every woman in my family got breast cancer with the exception of my mother, who had colon cancer. And growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. I'm dating myself right now. She wrote 54 hits in all, and her most famous song was The Greatest Love of All. So she wrote that song. Right? Take a moment. Holy moly, right? My cousin was literally a rock star. I'm not using that figuratively. I'm talking about my cousin was literally a rock star. Okay? And so she wrote The Greatest Love of All in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know. Because Linda died of metastatic breast cancer 1 month after Whitney released that song. I was 16 years old and my hero died. And her life and ultimately her death gave birth to my life's purpose. And I did the only thing I knew how to do because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. So I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. I became the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. And I did that for long enough for my aunt to be diagnosed. I did that long enough for my mother to be diagnosed. And with all the writing on the walls, in what was arguably the top of my career as I'm running the surgical department and I'm running the cancer program for my hospital, and I'm a wife and a mother and an athlete and a philanthropist and an author, and I have all these balls in the air and I think I'm an expert juggler. And I go from arguably being one of the most high-performing people that you've ever met to I can't walk across the room because I don't have the breath in my body. And, so what happens when your prize horse is injured, right? I have this intense 3-day workup. And at the end of the 3 days, I find myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo and radiation and things that I said all day, every day without hesitation or reservation. But I can assure you, when those words are coming at you, they have different meaning. I absolutely can be transported back to that room in an instant. And I remember exactly what it felt like in that time and space. And the only thing that I could hear, because I was like in Charlie Brown's classroom, right? Like I just felt like I was having this crazy out of body experience. And I couldn't silence this voice that said, there's something more, go find it. Now, I am a conventionally trained physician, right? Like I went to one of the best medical schools in the country. I'm an MD. I went through a surgical residency. I am a conventionally trained doctor. So I didn't know that there was anything else. I had no idea what this, call it God, call it universe, call it voice. I don't know what to call it, right? I had no idea where this messaging was downloading from, but all I could hear was there's something more, go find it. And so I go on a journey. And this journey was not to help my breast cancer patients, right? This journey was about me and figuring out how I was going to live because I had 2 young boys and they weren't ready to grow up without a mother. And so my husband hates it that I leave him out of that conversation. But then he doesn't listen. So what difference does it make? I go on this journey and God is good. And I am a deeply religious woman. And I find myself sitting in a room where this tall, lanky guy walks on stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, at this point, I'm sick, yes, but I'm still my cynical, snooty booty self and have like no idea what I'm doing here. And so all I could think of was like, I've been a doctor for 20 years. There's no such thing as a functional medicine physician. What is this quack talking about? And then I remember that I'm sick and I'm there for a reason. So I check my ego at the door and I tune in. And thank God I did. Because over the next 2 hours, I was to understand exactly why I got sick, exactly why I was in that room on that day, in that seat. I was there so that I could listen to this man explain to me how I was not only going to heal myself, but telescope the rest of my career and how I was going to save millions of lives. Because I learned on that day that, first of all, I was meant for so much more than that one-on-one in the operating room space. But the main thing that I learned on that day is that in conventional medicine, we're completely focused on the wrong thing. All of our focus, especially in the world of cancer, all of our focus is on the tumor. But the tumor is not the problem. The tumor is the symptom of the problem. And unless you start to understand the problem, unless you back up 20 steps and figure out why the tumor is there, what we're meant to learn, what is the message here, and how to course correct, then you're not helping anyone anyway. And I realized that as a surgeon, I wasn't helping to heal anyone. I mean, maybe I was delaying the progression of the disease, but I wasn't doing anything to stop that disease from coming back, or worse yet, to stop the next manifestation of the inflammation, of the systemic disturbance that led to the disease. So, that day was pivotal for me because I saw the whole medical universe through a completely different perspective and learned that, we don't have a healthcare system, we have a sick care system. And I got into medicine probably because for the same reasons that everyone else gets into medicine, because they really want to help people. They really want to cure people, only that's not what I was doing. And I learned on that day that I could. I learned on that day the potential that I had to not only heal myself, but the potential that I had to heal millions and millions of women. And so I'm an early adopter. I get really excited about things, and I'm a quick start. So on that day, I enrolled in the Institute for Functional Medicine, and I spent the next 3 years immersed in the study of functional medicine and on a healing journey for myself, since when you study things, you tend to try everything out on yourself. So I don't actually recommend that. I got a lot worse before I got better, dangerously, dangerously worse before I got better. I actually have a story around the DNA company because that was one of the things that I did when I got sick. And that's one of the things that helped to turn me around for the better and for health. So, the DNA company, I actually partially credit with saving my life. And so it took me 3 years, but I came out on the other side, and it was a bell that I couldn't unring. I couldn't go back to just being a surgeon because it wasn't enough, and it wasn't what people need, and it wasn't the right thing to do. So that's my story, and I'm sticking with it.
Wow. That's amazing.
Yeah. So in 2019, I left surgery. I founded Real Health MD, which is more or less a functional medicine oasis for people with a breast cancer diagnosis who really want to restore their health. And that certainly takes a special person because when we seek health, this is a very active process, and health is not a destination, it's a journey, right? And like any journey, it is fraught with landmines, and it's not easy, and it's a huge commitment. And it's very different than that model of go to the doctor and turn over your health to someone else, right? And I think collectively as a society, we really need to reevaluate that whole system because we cannot be farming out our health to people who don't know how to mind it. And right now, conventional medicine knows nothing about health. They know nothing about creating health. They know nothing about maintaining health, and they know really nothing about restoring health. And that whole pill for the ill system or procedure or whatever it is, it doesn't work. If you have an appendicitis, if you have a broken leg, if you have some kind of acute care emergency, we have a great system But if you have chronic illness, you are not served well inside of this system.
No, and I think, you're absolutely right that I believe that people give too much of their agency away,
Yes.
to these people
Yes.
wearing white
That's what
coats
I
thinking
mean.
that they know
Yes.
everything.
Yes.
Each of us, when we truly give ourselves the chance to look within, we truly know ourselves better than anyone. We need to start paying attention to what our body is saying to us, what it is asking for us.
Yes. The
And
messaging, you're absolutely right. Absolutely right.
there's so much I want to dive into. Okay, so I want to uh, dive into how you found the DNA company and how you used our DNA testing, our DNA 360 test to help you.
Yeah.
I would love to hear that.
Yeah. My vegan folk are not going to love this story at all. So I think it was in and around, must have been 2018, maybe 2019, could have been even a little later. And I'm in my vegan phase because I've been a vegetarian almost all my life. So interesting that when I was 11 years old at summer camp, my grandmother came to visit me for visiting day. And she brought with her an article. And it was about a guy who was advocating for a plant-based diet to cure cardiovascular disease. Do you know who I'm talking about? Do you know what article this would be? I'll
I
give
think
you a
I do.
date. It's in the 1970s, and it's Dean Ornish, right?
Mhm.
So my grandmother, when I was 11 years old, hands me the article by Dean Ornish, which was like revolutionary at that time, that plant-based diets could cure cardiovascular disease. And my grandmother said to me, "It's too late for me, but it's not too late for you." And I stopped eating meat that day. And I didn't eat it again for decades. So I am at my core plant-based. Like that's what I want to eat. That's what my body desires. But I was also ignorant in so many ways. So I didn't know that if you're not eating animals, you need to supplement. I didn't know. How do you know this? They for sure don't teach you that in medical school, right? We learn nothing about nutrition. I shouldn't say that's not true. They teach you about scurvy and rickets, right? Two diseases that literally do not exist anymore because we don't have such profound vitamin C and vitamin D deficiency for that to happen anymore because of fortified cereals and blah, 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 blah. So I knew nothing about nutrition. I had no idea that you had to supplement. And as I became more and more orthorexic after I got my diagnosis, because I thought that like maybe I had let myself slip and I was letting some animal products into my life and maybe that's why I got sick. So I became super duper orthorexic in terms of my veganism and I got way, way sicker. And I'm in Sachin Patel's mastermind. Do you know Sachin?
I do. He's one of my
Yeah.
mentors.
Yeah, he's amazing. He's amazing.
Mhm.
So I'm in his mastermind, and Kashif Khan comes on and presents this test, the DNA 360, and they offer it to the whole community. So I'm like, sure, why not? I'll take another test. Sounds great. So I take the test, and and Kashif goes over the results with me. Now, this is a long time ago. I think the test has come a long way since then. But I learned a lot about myself from that test. I learned about the fact that, first of all, I cannot be a vegan even if I were to supplement with B12, since that's one of the major things that's missing when you're on a vegan diet. Even if I were to supplement with B12, not good enough because I'm also not a beta carotene converter. So I can't, I can eat all the orange stuff that I want. I'm not talking about Skittles, obviously. I'm talking about the fruits and vegetables that are rich in that orange color because they contain lots of beta carotene. But I could eat that until the cows come home, but I can't convert it to the active form of vitamin A. So I'm going to suffer lots of problems as a result of being vitamin A deficient, like my immune system doesn't work because you need vitamin A for your immune system. So where do cancers come from? Cancers come from a failure of your immune system. I also, as it turns out, have terrible vitamin D genes. I'm not a good converter, I'm not a good transporter, and I do not have good receptors. So I'm walking around with a vitamin D level in the teens.
Wow.
In the teens, right? And I'm being a good little girl. I'm putting on my sunblock because what do they teach you in medical school and in dermatology rounds? They teach you that you should never be outside without your sunblock and you don't want wrinkles and you don't want this and you don't want that. So I'm covered in sunblock and I am vitamin A and so vitamin D deficient that I actually give myself cancer.
Yeah, and the endocrine disruptors that are in the sunblock.
Yes, all of that. And I learned a lot about my detoxification genes, of which they are terrible. So I yelled at my mother because it's obviously her fault. And I learned. I learned what my body needed. I learned how to nurture my nature. I didn't learn my lessons fast enough, and I continued to challenge my body in areas where I shouldn't have challenged my body. And I realized I used to go to spin class with my husband. Before our day would start, we would go to spin class at 5:45. And then I would be asleep at my desk at 10 o'clock. Like that intense exercise just does not work for me. I have very bad detoxification genes. So when I create all of those toxins in my body says, okay, but now you need to sleep. Now you need to rest. You can't do this 2 days in a row. You maybe can't even, you maybe need 2 days of rest between when you do this. So I kept trying all these things and wondering why I felt worse, why I couldn't be a runner, why HIIT class made me feel horrible, right? It's my genes. And so I learned when I did the DNA test, I wasn't listening to the signals of my own body. My body was trying to tell me. But when I did the DNA test, when I did the DNA 360, there it is in black and white. You need more rest. You need more recovery. And your body can't deal with these high intensity workouts. You need slow and low. So for me, it was life-changing. And it really wasn't until I did that test that I truly started to heal because I didn't know how to take care of myself before then.
Education, making people aware of information about their body, how it works, laying out the blueprint of their DNA, I think is absolutely foundational. We have to know the cards we've been dealt in order to be able to play the game and to play it well. And then you have to learn the rules of the game, and I think that's something where we come in as clinicians, as, working with functional genomics and giving that information to people, empowering them to reclaim that agency. And
absolutely.
I think it's absolutely amazing, what you are doing in your journey, in your awareness in what else was out there, that you're at the top of your game in that allopathic realm of knowing all about the structure of the body, the way that it works. But then
I mean,
stepping
I
into
think
the
they make us into anatomical experts, right? But
yeah,
we don't understand any of the physiology. Like they basically teach you that the first year in medical school. They teach you all about physiology and biochemistry. And they're like, okay, now you can forget all that. It's literally what happens. It's
yeah,
literally what happens. And when you then learn about functional medicine, you're like, oh, this is why we learned all of that, because we have to know how the body functions to be able to
right.
help it to function optimally, and we have to know where it's breaking down in order to have optimal performance and optimal health.
Yeah,
And so much of our system is based on mediocrity, right?
mm,
Like we in the allopathic system, it is only geared to recognize failure, right? There is nothing about optimal performance in the allopathic model. It's only designed to recognize failure. And that's what's so appealing to me about the functional medicine world is we're looking for exceptional. And that's what
right.
we expect. And that's what I now expect from my breast cancer patients. So,
Hmm.
when I get asked about statistics, I'm like, well, they don't apply to you because I expect my people to be the exception and to be
Right. We don't want
exceptional.
them normal.
I don't.
I don't
I
want to be
don't. I
normal.
don't want to be like 95% of people. And thank
Right.
you. Not interested. I want to be that top 5%. I want to be that top 1%.
Right.
Right? Like, I want to be the standard that everyone wants to live up to. That's where
Yeah,
I
and
want to be.
it's it's taking it from that siloed perspective, taking us in parts and pieces and opening up the world to the connectedness, the systems biology.
Yes.
Everything is connected, and you
Yes.
have to understand that to be able to even reach optimal performance. Speaking of being optimal, how do you define optimal breast health, optimal women's health?
Yeah. So that's a great question. And this is something that I think about all the time because, like, that whole siloed system has us thinking that breast health is somehow separate. But the bottom line is that breast health is health. And the same things that are going to give you healthy breasts are also going to ensure that you have a healthy brain and a healthy heart and healthy bones and healthy joints and healthy skin and healthy lungs and a healthy gut and healthy vagina and healthy bladder and healthy mood and healthy hormones, right? Like breast health is health, the same way that fertility is health. I think about what we've done in that arena. And I mostly think about that because I'm like 10 years beyond infertility, right? Like what happens with women is they start off with cycle irregularities and get put on birth control pills. And then they get to the point where they want to have babies. So they come off the birth control pills and then they get treated for infertility, which is like forcing a pregnancy on them. But fertility is health. So if you're not getting pregnant, there's a reason why. We shouldn't be forcing fertility, but we never deal with that reason. We force a pregnancy on them. And then 10 years later, they're in my office because they have breast cancer, right? So we should be thinking about breast health is health back when they're babies and come all the way forward because we need to stop siloing that. Everything is health. We have to think about everything. We have to think about the system as a whole. And you can't have healthy immunity without having a healthy gut, right? You can't have a healthy heart, but not have a healthy gut. Like all of it is you don't have one thing that's healthy and the rest of the things that aren't. If something's off, the entire system is off.
Right. All the parts and pieces are connected.
Yes, they're all connected. And, you think about like a little screw as part of a machine. And okay, so what if that little screw falls out? Well, if the little screw falls out, the whole machine falls apart, right? So it doesn't work. So everything is important and we need to start treating it that way. Everything about our health is important. Now, that does not mean that you are obsessing, right? Like the orthorexia that I talked about before. That's not what it's about. You don't have to be perfect, but you have to prioritize the whole self, right? You're not just aiming for a healthy gut, right? Everything about you is a priority because we need to think about ourselves as a system because we are. We are.
You know, this really is so amazing. The perspective, the way that you have, I, I wouldn't say necessarily shifted. I would say expanded your understanding, your perspective, the way that you care for women. Which brings me to a question on what is it like to be a patient in your clinic? Can you walk me through the process on,
Yeah. I mean,
someone coming
you
in and
know, I think for someone who is coming in from the conventional medical world, this is probably the first time where you've been listened to, where there aren't time limits, where you're not being rushed out, and where you're being asked things that probably you've never been asked before. I mean, I'm asking people, how was your mother's pregnancy with you? Were there any issues? She's like, I'm 61 years old. Why are you asking me that? Because I legitimately want to know. I want to know what your health was like when you were born. I want to know what your health was like when you were a child. I want to know what your health was like when you were a teenager, because all those things led up to today. So, what am I dealing with? What do I need to uncover? I remember I had this amazing, amazing, wonderful, God rest her soul, patient, Susan. And Susan came to me after, I guess, she had been diagnosed with metastatic breast cancer. And she had just left like a really, really, really high pressured government job. And when she was diagnosed with metastatic disease, she decided she was going to leave the job and really try to recover her health. And she was 50 or 60 pounds overweight and was smoking and drinking and doing all the things that we know really contribute to disease. High stress, overweight, eating the standard American diet, drinking alcohol, smoking cigarettes, lots of toxins, toxic life. And we spent almost a year working together to really remake all of that. She lost 80 pounds. She was the healthiest she ever was in her life with no detectable disease. And then we started to uncover maybe somewhere else where this was coming from. And she told me about when she was 11 years old and her parents owned like a ski resort. And she was actually gang raped by a bunch of like the boys that would hang out at the resort every weekend. She told her parents about it, and her parents didn't believe her because they knew the boys and didn't think the boys were capable of that. And she walked around with that burden her whole life. And it really wasn't until she released that burden that she really started to get well. Unfortunately, she got better and then went back to, oh, I can drink again. Oh, I can eat again. Oh, I can. And it's not permanent. You have to work at your health all the time. So I actually have women who have metastatic disease, widely metastatic disease, who are alive for 5 and 6 and 7 and 8 and 9 years and well beyond the time that anyone told them that they would be alive. But health is a constant journey and you have to stay on the trail. You have to stay on the trail. Yeah. But
it's
to be a patient with me is really it's vulnerable and it's uncovering all of these things because we have to get toxins out. And sometimes the toxins are obvious and sometimes the toxins are not so obvious. Sometimes the toxins are things that are quite invisible most of the time. The difficult relationship, the divorce that needs to happen, the job that's horrible and killing you, or you're living in a house that has mold. You're living somewhere that's unsafe. I don't know. Whatever it is, we're going to uncover it. And so it's a far more in depth, vulnerable experience than you've ever had before. But at the same time, it's tremendously meaningful when you're listened to, when you're heard, when your voice matters, when your vote counts, when you're in the driver's seat of your health. Because I'm not into paternalistic medicine. It doesn't matter what I think you should do. It matters what you think you should do. For sure, I'm going to give you all the facts. I pride myself on people making informed decisions because right now they're not. Right now, in the conventional medical space, they are not making informed decisions because they're not giving the information to do it. That's why I wrote my book, The Smart Woman's Guide to Breast Cancer, so that people could actually make informed decisions about their treatment and so they could participate because they need to participate. Because health doesn't happen in a hospital or a radiation suite or a chemotherapy suite or an operating room. Like, it doesn't matter how talented I am. I wasn't making anyone healthier. Like, surgery never made anyone healthier. Chemotherapy never made anyone healthier. Radiation never made anyone healthier. Health happens at home, and it happens with the things that you do every day. And the only person that can make you healthy is you. And that's what you get at my center. That's what you get. You get the tools that you need to make you healthy.
That is so beautiful. I love that. And it's the same principles that I use myself with my clients. And I'll tell you, I find that there are two major hats that I have to put on for a successful relationship with the clients. And one is of an investigator, playing Sherlock Holmes,
Yep.
asking all the questions, being extremely curious, digging deep, and, asking those questions that have never been asked before, because you never know where that pearl will be hiding that could be the catalyst for major change. And the other one is the cheerleader, allowing
Yes.
that person to be
Yes.
heard and cheering them on, letting them know that the work that they're doing is important, to celebrate those wins. That's so important that they have and are supported with that wind under their wings, and, letting them know you're on the right track, keep going, you can do
Yes.
this.
Yes.
So
So important. That
I
positive
feel like,
reinforcement.
oh my gosh, I guess. And it's, to me, I think it also so important to realize, and you mentioned this as well, they are in the driver's seat. They're the ones driving the bus. I'm just the tour guide, giving them information. But they're the ones who have to make the turns and have to, press on that gas pedal, or, if push on
Yeah.
that brake if they
And
need
do
to
the hard things.
pause a little bit. Another question I had is, what is one unconventional idea or intervention that you believe in, even if it's not widely accepted yet? Maybe even within the functional medicine world.
Yeah. Well, I'm turning breast imaging on its head. And, this is a major, major, major shift because right now, for the last 50 years, our entire breast cancer screening program has relied on mammograms. And as a conventional medical doctor, I ordered mammograms for everyone, liberally, without thinking about it, without pausing, without hesitation, right? Because I was drinking the Kool-Aid. They told us mammograms were safe, and I believed them. They told us mammograms saved lives, And I believed them. They told us that mammograms saved breasts because if you find something earlier, people get less treatment. And I believed them. And as it turns out, none of that is true. And still, even though my colleagues on the functional medicine side, especially the people that are doing hormone replacement, my colleagues on the functional medicine side know the dangers of mammograms, and they intuitively know that mammograms don't save lives and that mammograms actually increase the risk of breast cancer. But the truth is that they also won't write for hormones for people without having a mammogram first, clearing the breast because they don't know what else to do. Right? So they're caught between a rock and a hard place. And I am forever changing that. And I'm forever changing it because mammograms do not save lives. And that is definitive, right? We have huge studies with hundreds of thousands of women proving that and from a population standpoint, mammograms do not save lives. We can look at the Swedish study, 600,000 women. Half of them undergo screening with mammogram, half of them just physical examination and yearly visits to their doctor. In Sweden, everyone has the same access to, it's universal health care, right? So they all have the same access to care and they all have the same access to the same kind of care. It's not like one group got better care than the other, right? So it's the best controlled study that we have. And both groups, the same number of women die of breast cancer in both groups. There is no difference in survival between the groups. And the only difference is that if you screen with mammogram, you actually will detect 20 to 30% more cancers. And those women are then unnecessarily treated for cancer. So their overall survival is less. Because when you treat a woman for breast cancer, with surgery, with chemotherapy, with radiation, you accelerate heart disease, the number one by far exponential threat to a woman's life. You accelerate heart disease, you accelerate brain disease and degeneration. So more Alzheimer's, more dementia, shorter lifespan. You accelerate bone loss. And lest we forget, the same number of women who die of breast cancer every year die of a complication of a fracture. The same number of women. So we cannot be creating the disease and the treatment being worse than the disease, which is what's happening right now. And so that was one trial. There's a second trial that I speak of all the time because there is now a push to have younger women get screening. That maybe it doesn't make a difference in the older population, but maybe in the younger population, mammogram will save lives. So let's look at the data. The Canadian breast cancer screening trial, again, same thing, universal health care, so everyone has the same access. Now we're looking at women only ages 40 to 59. So young women, 45,000 get screened with mammogram, 45,000 are just having physical examinations. The same results. The same exact number of women die of breast cancer in each group. And the only difference is that if you use mammogram to screen, you're going to diagnose 23% more breast cancers. How can we let this go on? Now, mammograms do not save lives. That's definitive. That's proven. But if they saved breasts, right, that would be a worthwhile cause. If we were decreasing the mastectomy rate, then that would be a worthwhile cause because I don't care how you try to prepare a woman for mastectomy. I don't care how much informed consent you think you're giving her. I'm telling you that those scars run so deep that if you if a woman has a mastectomy, there will never come a day for the rest of her life where she won't remember that she had breast cancer. Really, truly. Mastectomies are devastating. They are absolutely, positively devastating for so many reasons. So if, in fact, mammogram saved breasts, I think that would be a worthwhile endeavor. So let's look at the data. What happens when you screen with mammogram? Well, as it turns out, the mastectomy rate has increased by 20% when you use mammogram to screen. So we're not saving lives. We're not saving breasts. What are we doing? Well, actually, we're creating a lot of disease, and it's just logical. A mammogram is an X-ray. This is radiation. This is ionizing radiation. We know in every other scenario that ionizing radiation causes cancer, that ionizing radiation is a known carcinogen, and yet we try to sell it to women like it's perfectly safe, like it's the same as flying a cross-country flight. And that might be true in the absolute amount of radiation, although I would argue that it's not. But even if it were true, there is a vast difference between the scattered radiation that you get on a cross-country flight and the focused cone down radiation that you get to the vulnerable, traumatized tissues of the breast during a mammogram. These things are not the same. A 3-year-old can understand this, right? And it astounds me that we still have brilliant people inside of the conventional medical world advocating for mammograms and saying that they're safe and using that radiation explanation, justification, like it's true. It's just astounding to me. So this has probably been the biggest shift for me from when I was a conventional medical doctor and now. So I do not advocate for screening mammogram ever, ever, ever for anyone, because I don't believe in exposing a healthy woman. And let's face it, that's what the screening population is. Because if we thought she had breast cancer, if we had some reason to believe that she had breast cancer, that's no longer screening, that's diagnostic, right? So, right. And I'm not saying no one's ever going to get another mammogram again. Like, I'm not throwing the baby out with the bathwater. I get it, right? And I'm using it when I need to use it. If I need to like speak in the terms that the conventional medical world is speaking, and I have someone with a breast cancer that's the only way that they're going to see them, okay, so they go get a mammogram. But I am not exposing healthy tissue to radiation. I'm just not doing it. Well, and we don't even have to do it anymore because there are safe and totally effective ways to screen for breast cancer. So the way that I screen is I have everyone do a self-breast examination, because no one is ever going to know you better than you know yourself. And everyone thinks their breasts are lumpy, and it's okay. You just need to own your lumps. Then I have everyone getting the ARIA test. Do you know about the ARIA test? Have you heard about this test?
Yes, I have.
So the ARIA test is a test that actually looks for 2 inflammatory proteins, the S100A8 and S100A9 proteins. And as it turns out, when you have high levels of these proteins, these are precursor proteins to breast cancer, and they are abundant in your tears.
Tears, yes. We have our breast 360, our DNA breast 360 test. That's what we do.
So yes. You know what? I did hear that you were developing, so I'm sorry to mention a competitor. But if your test works the same way, then let's talk about your test.
The same. Yes.
Yeah. Let's just talk about the tears test. Okay. So with this test, I honestly believe that this is going to replace screening mammogram, because we can tell from this test who does and who does not need to be imaged.
Correct.
Right? Because if you have a clinically significant result on this test, if you have enough of those proteins to trigger a positive result on this test, we know that you either have breast cancer or you have the inflammatory precursors to breast cancer. So everyone who has a clinically significant result, I then do imaging on. But the imaging that I do, I either do QT, and I've opened up these imaging centers, and I plan to open up 50 so that everyone in this country who wants access to this test gets access to this test. But this is 100% safe, effective, radiation free, painless. It's actually a lovely experience where we use sound waves transmitted through a warm water bath. So a woman lies down, her breast gets submerged in warm water, and she feels nothing, she hears nothing. And in a 20-minute meditative like experience, she has a full imaging of her breast where we are creating a 3D reconstruction of her breast with more sensitivity and more specificity than anything else. It's very comparable to an MRI without the gadolinium, without the magnet, without the discomfort, without the noise, right? And so this, without question, is going to replace all the imaging modalities that we currently have because it is unethical to expose a healthy woman for the purposes of screening to radiation, to gadolinium, to pain. It's just, it's barbaric and it needs to stop. And I'm changing that.
That is absolutely incredibly fantastic and wonderful. And I am so glad you are making the charge to do that. And you've got so
I'm
many
excited to use
people
your
behind it.
test.
Yeah, I'll tell you, it is fantastic. And I love that it is non-invasive, that it
Yes.
is available to everyone. I mean, there are so many young
You
women
just
now
do it at home.
that breast cancer is now an issue, but they do not fall within the typical age confines of,
Yeah. Well,
of
those
being
age confines are
looked at.
changing.
Oh my gosh. Well,
I
not
know.
just that, but you think of these areas in more rural communities where they don't
Yeah.
have, they have to travel hours to get to a hospital to
Yes.
be able to have some of this testing or diagnostics or something like that. And
But
again,
these kinds of tests are going
can
to
be done
change
right at
all
home.
of that for them.
Mhm. Yeah, I mean, just, few minutes, just having that little strip, in between the eyelid and, just sending that in comfort of their own home to have that precursor, that test. Again, it doesn't state that you have breast
No.
cancer or not, but it's
Yeah.
a
So
great
we need to
thing
be careful when
look
we
at.
talk about it, right? Because it's
Right,
not really a screening test for breast cancer. It's a screening
right,
test for the inflammatory precursors of breast
correct.
cancer. And many women who have a clinically significant or a positive result on that test will not have breast cancer. But you know what you do have? You have opportunity.
Mm-hmm.
Because the truth is that we can use this test to prevent a breast cancer diagnosis. Because if you know that you're at risk, and if you know you have the opportunity to mitigate that risk, listen, some people will choose not to. But I think most in this day and age will choose to do the work to ensure their health going forward.
And it's the perfect opportunity to start laying the foundations of cleaning up the terrain, of
Yes.
getting their DNA done so they don't have to stumble and around
Yes.
trying to figure it out, that they'll know, can I be vegetarian? Do I need to,
Well, that's right.
get
And
the
so
surface?
I have actually a prevention program, and this
Right.
is the foundation of my prevention program because unless you know what makes your body work optimally, how do you optimize? Right? You have to know.
Mm-hmm.
You can't guess. And we're all different. You can't tell by looking at someone what they need. And you can't tell by trial and error what they need. You have to test. And we have the opportunity and the ability to do it right now. So we should be doing it. So that's what my prevention program is all about, because we're testing people's genetics and we're letting them know what they need, what kind of diet they need, what kind of movement they need, how they need to prioritize their sleep, what supplements they need, what supplements they don't need, right? Everyone's
Right.
got a supplement graveyard. Let's stop that. Let's not have supplement graveyards. Let's give ourselves what we need.
Right. Yeah, streamlining is so important, especially with the cost of everything nowadays.
Yes.
Eating organic, eating clean. My goodness, I could, put you in the poorhouse. And, with
True.
all the other, supplements and, biohacking devices, which honestly, there are some fantastic things, but there are many things that maybe they could do without. It's really
Yes.
knowing where to invest the time and the money.
Agreed.
And
Agreed.
yeah.
But, if you find out that you have terrible detoxification genes,
Mhm.
you might want to prioritize getting an infrared sauna,
Oh,
right?
definitely.
Like you
Or air
it'll
filters or a water
air
filter.
filter. What?
Yes.
Yeah, of course. All of that. Like, and you just know that this is something that will guarantee your health going forward, because the truth is that we think that being healthy is expensive, but really being sick is expensive.
There was a comment a mentor of mine made before that a healthy man, a healthy person, has a million goals, has a million dreams. A sick one has one.
So true.
I would rather
So
have a
true.
million dreams
I
and goals
know.
myself.
I know. Well, I
So
already do. like I'm like the the ultimate like entrepreneur. I'm like squirrel, squirrel.
I get like that too, going down rabbit holes, and it's just
Yeah.
I like to know the inner
Yeah.
workings,
I
what's the
like all
mechanism
the
of
shiny
action, what's
objects. I'm like, ooh, shiny objects. Yay!
it's like let's play with it and see how it
Yeah.
works.
Yeah.
I like using myself as a guinea pig. I like to actually play with, use, test out before I start recommending. So that way I know how to navigate that. It may not necessarily work for me, but it doesn't mean it's not going to work for someone else.
For
But at
sure.
least I have some, personal
Context. Mhm.
experience and
Yeah.
context, yes,
Yeah.
with it.
Yeah.
So I really get into all of that. So let me ask you, what is your long-term vision for the future of biohacking, of functional medicine? What role do you play in this? I mean, I know that you've, definitely you are going to be playing a huge role in this new diagnostic testing, this new imaging
Yeah.
with QT.
Yeah.
But kind of working beyond there, maybe I should expand that a little bit and ask you about your legacy,
Yeah.
your role in all of this, like looking back on your work another 10, 20 years from now.
Yeah.
What do you
So,
see?
I mean, I know that I'm going to prevent millions of breast cancer diagnoses, because when we look at the numbers, so if you look at 2024, and we had 300,000 women in this country diagnosed with breast cancer. So if we overdiagnosed 20 to 30% of them, we're talking about 60 to 90,000 women every year overdiagnosed. So I'm getting rid of those, right? We're not going to cause breast cancer anymore with mammograms, and we're not going to overdiagnose people. So I already know in 10 years I'm going to nearly save 1 million women, right? So that feels pretty good,
Yeah.
right? That feels pretty good. On the flip side of it, though, we have what I call the forgotten woman, because we have 4 million women currently living in the United States with a breast cancer diagnosis, either current or past. And what happens with all these women who are treated for breast cancer is they're treated with surgery and chemo and radiation and anti-hormonal, and they're all rendered menopausal. If they're not already menopausal, they're all rendered menopausal. And they're told that they should be grateful to be alive. And they are grateful. But it is very hard to feel grateful when you can't think, you can't remember your words, you're depressed, you're anxious, you're afraid, everything in your body hurts, you have no energy, your mood sucks, you've gained weight, your breasts are deformed or absent, you have palpitations, you have no stamina, frequent urinary tract infections, yeast infections, your gut is not working, you feel gassy and bloated, your clothes don't fit, you have no libido, sex is unwanted and painful, your relationship is suffering or absent. It is very hard to feel grateful when all of this is going on. And yet, this is how we leave most women after breast cancer, and we tell them that they should be grateful to be alive. And a lot of this is about we just abandon them and we tell them that there's no hope for hormonal health from them. And they're not getting nutritional support. They're not getting the kind of support that we talk to everyone else about, because everyone is afraid of them because they've had breast cancer. And the thing that they're most afraid of is giving these women hormones. Yet they no longer carry a breast cancer diagnosis. And if they're like the women that are working with me, they've made sweeping, monumental changes in the way that they live their life, in the things that they eat, in the way that they sleep, in the way that they move, in the things that they use in, on, and around them, in their detoxification practices. They've made sweeping changes. So they've learned how their hormones work, how their hormones detoxify. They've learned how to optimize all of that. Why can't they have hormones? Because I say they can. And so I am changing that. And I am changing the last 20 years where we have been told a story about estrogen that simply is not true. Estrogen does not cause breast cancer. And in fact, estrogen is the hormone of life. And it's when the estrogen goes away that we actually start to deteriorate. That is the beginning of our deterioration, is when the estrogen goes away. And breast cancer is far more a disease of estrogen deficiency than it is a disease of estrogen excess. It is not a disease of estrogen excess. So I am changing the screening conversation. I am for sure changing the hormone conversation. And I'm making sure that women with a history of breast cancer have access to health. And that often means hormone replacement. So that is going to be my legacy. And, I won't be known as the best mother, and I won't be known as the best wife. But I will be for sure known as the woman who changed the conversation around breast cancer, around how we diagnose it, around how we treat it, around how we prevent it, and around how we screen for it.
Wow. Mic drop. I love that. Dr. Simmons, this is absolutely amazing. Just the passion, that the work that you do, I can't even fully put into words everything and how grateful we are to have you on this earth doing the work that you're doing, saving women beyond just saving their breasts, saving their lives. Thank you. Thank you for doing
Thank you for
the
having
work.
me. It was an absolute pleasure.